Have you ever wondered how a tiny virus can bring the whole world to its knees? The power of pandemics to disrupt societies and economies is both fascinating and terrifying. From the bustling streets of our cities to the quiet corners of our homes, no place is truly safe when a pandemic strikes. It's like a domino effect, where one infected person can set off a chain reaction, leading to millions of cases worldwide. These pandemics, terrifying as they are, also highlight the incredible role of science in understanding and controlling these outbreaks. Our scientists work tirelessly, studying these microscopic threats, developing vaccines, and devising strategies to protect us. From the Spanish flu to COVID-19, each pandemic has left an indelible mark on humanity, shaping our history and our future. They've exposed our vulnerabilities, yes, but they've also highlighted our resilience, our capacity for innovation, and our unity in the face of adversity. The history of pandemics reveals a lot about our vulnerabilities and our strengths as a species. Our adventure commences in 1918 with a hidden adversary, the so-called Spanish flu. Contrary to its name, this pandemic didn't actually start in Spain. The label came about because of Spain's neutrality during the First World War, which allowed it to report without censoring news about the flu. The real genesis of the virus remains uncertain, with speculations pointing towards China, the United States, or perhaps France. The Spanish flu proliferated swiftly, fueled by the international movement of soldiers during the war. Within 2 years, it had infected an estimated 1/3 of humanity. The aftermath was catastrophic, with death toll predictions varying from 20 to 50 million people globally. This figure surpassed the sum of the war's casualties. But what did we scientifically comprehend about this virus? In 1918, virology was an emerging field. The idea of a virus, an infectious agent smaller than a bacterium, was recognized, but we lacked the technology to visualize these microscopic invaders. Scientists were essentially groping in the dark, depending on observations and symptoms to inform their reactions. Public health policies varied drastically. Some cities, such as St. Louis in the United States, initiated early and continuous measures like school shutdowns, public gathering bans, and sick person isolation. These cities experienced lower mortality rates than others, like Philadelphia, that were slow to respond or eased restrictions prematurely. The Spanish flu demonstrated to the world the crucial role of synchronized public health measures in managing a pandemic. Nevertheless, the Spanish flu was more than just a tragic occurrence in our past. It served as a pivotal moment, a global alert to the devastating potential of pandemics. It catalyzed the creation of national public health organizations and fueled advancements in virology and epidemiology. The flu was a stark reminder of the devastating potential of pandemics. Fast forward to the late 20th and early 21st centuries, a series of new threats emerged. In the final decades of the 20th century, the world faced a new and formidable foe, HIV/AIDS. This disease, unknown and mysterious at its onset, quickly spread across the globe, leading to a pandemic that continues to this day. Yet, the emergence of HIV/AIDS also marked a turning point in our understanding of pandemics. Scientists across the world united their efforts to understand this new disease, to discover how it spread, and to find ways to combat it. This international collaboration led to significant advancements in virology, immunology, and public health practices. But the lessons from HIV/AIDS were soon put to the test, as the 21st century presented its own challenges. In the early 2000s, the world was introduced to SARS, severe acute respiratory syndrome, followed closely by MERS, Middle East respiratory syndrome, and H1N1, also known as swine flu. Each of these diseases, caused by previously unknown viruses, posed unique challenges to public health. However, armed with the knowledge and experience gained from HIV/AIDS, the global scientific community responded swiftly. We've seen scientific knowledge and public health measures improve with each new pandemic. For example, the time taken from the identification of a new virus to the development of a vaccine has dramatically decreased. With SARS, it took about 20 months. With H1N1, it was down to 5 months. That's a testament to the power of learning from the past. But it's not all about the science. Public health measures have also evolved. We've learned that simple actions, like hand washing and wearing masks, can slow down the spread of a virus, Contact tracing and quarantine measures have also been refined and implemented more efficiently. Each new pandemic presented its own challenges, but also opportunities for scientific progress. Indeed, the knowledge we've gained from past pandemics has been instrumental in shaping our response to new ones. And as we continue to learn and adapt, we are better prepared for whatever the future may hold. In late 2019, a new virus emerged, one that would reshape the world in ways we could hardly imagine. This virus was a novel coronavirus, officially named COVID-19, and it originated in the city of Wuhan, in the Hubei province of China. This microbe, invisible to the naked eye, soon began its silent yet devastating march across the globe. It infiltrated our lives, our societies, our economies, and our sense of normalcy. From bustling metropolises to remote villages, no corner of the world was left untouched. This was not just a health crisis. It was, and continues to be, a global crisis affecting every facet of human life. As the virus spread, so too did our understanding of it. Scientists around the world mobilized in an unprecedented way. They sequenced the virus's genome, studied its behavior, and worked tirelessly to develop effective treatments and vaccines. All the while, public health officials worked to control the spread through measures like social distancing, mask mandates, and eventually, mass vaccination campaigns. But as we grappled with the virus, we also grappled with our own responses. The crisis brought to light stark inequities in healthcare access and outcomes. It underscored the importance of clear, consistent communication in a time of widespread fear and uncertainty. It reminded us of the crucial role of global cooperation in the face of a common enemy. The fight against COVID-19 is a testament to human resilience and the power of science. It's a story of tireless researchers working around the clock, of healthcare workers on the front lines, of communities coming together even as they stayed apart. It's a story of innovation, adaptation, and perseverance. COVID-19 has shown us, more clearly than ever, the vital role of science in responding to pandemics. The world has changed, and we've learned that our ability to adapt and respond is key to our survival. As we look toward the future, let's remember the lessons of this time and continue to value and support the scientific efforts that help us navigate our way through global crises. So how do we fight back against these invisible enemies? This question has prompted the scientific community to develop some of the most crucial tools in our arsenal. Vaccines. Vaccines are like training courses for our immune system. They introduce our bodies to a harmless version of a virus, allowing our immune systems to recognize it and learn how to defend against it. Vaccines have played a pivotal role in controlling pandemics throughout history. From the flu vaccine, which has saved countless lives since its creation in the early 20th century, to the remarkable speed at which COVID-19 vaccines were developed and distributed. These vaccines have proved to be game changers, substantially reducing illness and death rates. But vaccines alone are not enough. They are just one piece of the puzzle. Public health measures are another crucial component in controlling outbreaks. These measures involve actions that we as individuals, communities, and societies can take to prevent the spread of diseases. Consider the simple act of hand washing. It's a basic, everyday habit, yet it's one of the most effective ways to prevent the spread of many types of infection. Then there's social distancing, a strategy that became all too familiar during the COVID-19 pandemic. By keeping a safe distance from others, we can reduce the risk of catching or spreading viruses. And let's not forget about masks. Wearing a mask is a simple and effective way to block respiratory droplets, which are the main way that viruses like the flu and COVID-19 spread. Masks have been shown to significantly reduce the transmission of these diseases. In the battle against pandemics, we are not defenseless. We have tools at our disposal. We have vaccines that train our bodies to fight off viruses. We have public health measures that can prevent the spread of diseases. Together, these tools offer us a powerful defense. Remember, the war against pandemics is a collective effort. It requires the cooperation of everyone. As we continue to navigate these challenging times, let's not forget the importance of these tools. Vaccines and public health measures are our best defenses against pandemics. Pandemics have shaped our past and present, but what about our future? As we delve into this question, let's first consider the lessons we've gleaned from past pandemics. From the Spanish flu to the recent COVID-19, history has taught us that pandemics can arise unexpectedly, spread rapidly, and have a profound impact on societies worldwide. Yet, each pandemic has also presented us with invaluable lessons, ones that can guide our responses in the future. One of the key lessons is the importance of swift and decisive action. When faced with a new disease, time is of the essence. Early detection, immediate isolation, and prompt treatment can make a world of difference, slowing the spread and saving lives. Another crucial lesson is the power of collaboration. Pandemics are global problems that require global solutions. Nations must work together, sharing resources, knowledge, and expertise to effectively combat these health crises. From scientific collaborations to develop vaccines to international policy coordination, cooperation is paramount. Moreover, we've learned that public health preparedness is not merely a luxury, but a necessity. Robust healthcare systems, effective communication strategies, and well-planned emergency responses are vital to manage pandemics. But beyond these lessons, we must also remember the ongoing importance of scientific research. It is through research that we uncover the mysteries of diseases, develop effective treatments, and find ways to prevent future outbreaks. Science is our greatest ally in the fight against pandemics. As we look forward, we must keep these lessons in mind. We must continue to invest in our healthcare systems, foster international cooperation, and support scientific research. We must also remember the importance of individual actions, such as practicing good hygiene and getting vaccinated, in controlling the spread of diseases. In the face of future pandemics, we are not helpless. We are armed with knowledge, experience, and the power of science. As we look to the future, we must remember the lessons of the past. Pandemics may be a part of our world, but they don't have to define it.